Hello guys, in this video I will discuss about congestive heart failure. Congestive cardiac failure, CCF, also known as heart failure, is a condition where the heart is unable to pump blood effectively to meet the body's needs. This impairment in heart function leads to the buildup of fluids in tissues, causing congestion in the lungs, liver, abdomen, and lower extremities. Causes of congestive heart failure. 1. Coronary artery disease, CAD, most common cause. Atherosclerosis reduces blood flow to the heart, leading to ischemia and weakening of the heart muscle. 2. Hypertension, high blood pressure, increased workload causes the heart to enlarge, hypertrophy, and eventually weaken. 3. Myocardial infarction, heart attack, damage to heart muscle reduces its ability to pump effectively. 4. Cardiomyopathy, disease of the heart muscle, often due to genetics, alcohol, drugs, or infections, leading to impaired heart function. 5. Valve diseases, conditions like aortic stenosis or mitral regurgitation cause the heart to work harder, weakening over time. 6. Arrhythmias, irregular heart rhythms can impair effective pumping, leading to heart failure. 7. Other causes, diabetes, thyroid disorders, chronic kidney disease, and congenital heart defects can also contribute to CHF. Types of heart failure. There are two main types of heart failure based on the part of the heart affected. 1. Left-sided heart failure, or systolic heart failure, or diastolic heart failure. 2. Right-sided heart failure. A systolic heart failure occurs when the left ventricle cannot pump blood out effectively during systole, reducing the ejection fraction, the percentage of blood pumped out with each beat. B. Diastolic heart failure. The left ventricle has trouble relaxing and filling with blood during diastole, often with preserved ejection fraction but increased stiffness. 2. Right-sided heart failure. Usually a result of left-sided heart failure, where increased pressure from the left side causes a buildup of fluid that affects the right ventricle, eventually impairing its ability to pump blood to the lungs. It can also occur due to conditions like chronic lung disease. Symptoms of congestive cardiac failure. The symptoms depend on the side of the heart that is failing. Left-sided failure. Shortness of breath, especially when lying down or with exertion, fatigue and weakness, persistent cough or wheezing, due to fluid accumulation in the lungs, pulmonary edema, fluid in lungs, which can cause pink, frothy sputum, decreased exercise tolerance. Right-sided failure. Right-sided failure, peripheral edema, swelling in the legs, ankles, feet, and abdomen, ascites, fluid buildup in the abdomen, liver congestion, hepatomegaly, causing right upper quadrant pain, jugular venous distension, bulging neck veins. Compensatory mechanisms in CCF. The body attempts to compensate for the reduced cardiac output in several ways. 1. Increased heart rate. The heart beats faster to try and maintain blood flow. 2. Ventricular hypertrophy. The heart muscles thicken to pump more forcefully, but this can worsen the condition over time. 3. Activation of the renin-angiotensin-aldosterone system, RAS. This system causes fluid retention and vasoconstriction, which increases blood volume but also places more strain on the heart. 4. Sympathetic nervous system activation. Increases heart rate and constricts blood vessels, raising blood pressure. Over time, these mechanisms can worsen heart failure and lead to further fluid accumulation. Stages of heart failure, based on the ACC/AHA guidelines. Stage A, At high risk for heart failure but without structural heart disease or symptoms. Stage B. Structural heart disease but without signs or symptoms of heart failure. Stage C. Structural heart disease with prior or current symptoms of heart failure. Stage D. Advanced heart failure requiring specialized interventions, e.g., heart transplant or mechanical support. Diagnosis of congestive heart failure. 1. Clinical examination. Symptoms such as shortness of breath, edema, and lung crackles, along with physical signs, like elevated jugular venous pressure, are key indicators. 2. Echocardiogram, an ultrasound of the heart used to assess ejection fraction, ventricular function, and valve abnormalities. 3. Electrocardiogram, ECG, may show signs of heart damage, arrhythmias, or hypertrophy. 4. Chest X-ray, can show signs of fluid in the lungs, pulmonary edema, and heart enlargement. 5. Blood tests. Natriuretic peptides, BNP or NT-proBNP, are markers that increase in heart failure. 6. Cardiac MRI, CT, advanced imaging used in some cases to assess heart structure and function. Management of congestive cardiac failure. 1. Lifestyle modifications. 2. Pharmacological treatment. 3. Surgical, interventional treatments. 4. Monitoring and regular follow-up. 1. Lifestyle modifications. Reducing salt intake to lower fluid retention. Weight loss, especially in overweight individuals. Smoking cessation and alcohol moderation. Regular physical activity to improve cardiovascular fitness in stable patients. 2. Pharmacological treatment. A. Diuretics help reduce fluid overload, e.g. furosemide, torsemide. B. ACE inhibitors. ACE inhibitors help the heart pump more efficiently by relaxing and opening blood vessels, e.g. moexapril, perindopril, quinapril, ramipril. C. Angiotensin II receptor blockers, ARBs. They work by relaxing blood vessels and arteries to lower blood pressure, e.g. azilsartan, candesartan, apresartan, losartan, olmesartan, telmisartan, valsartan. D. Beta blockers. Beta blockers help the heart pump better, manage blood pressure, and lower the risk of heart attack, e.g. bisoprolol, carvedilol, metoprolol, nebivolol. A. Aldosterone antagonists reduce fluid retention and prevent worsening heart failure, e.g. spironolactone. F. Digoxin helps improve heart contractility in some cases of systolic heart failure. G. SGLT2 inhibitors. Originally diabetes drugs, these have been found to reduce mortality in heart failure. 3. Surgical, interventional treatments. A. Implantable cardioverter defibrillator, ICD, to prevent sudden cardiac death in patients with high arrhythmia risk. B. Cardiac resynchronization therapy, CRT, for patients with electrical conduction problems that impair the heart's ability to pump efficiently. C. Heart transplantation, in end-stage heart failure where other treatments are ineffective. 4. Monitoring and regular follow-up, frequent assessments of fluid status and kidney function. Adjustments in medication based on clinical status. Thanks for watching. Please subscribe, like and drop comments to support my work.